My name is Autumn McCoy. This is for NUR 400, and this is inserting an NG tube, administering medication through the tube, and removing the tube. So first I would have assessed the patient, make sure that they didn't have any nasal surgery, they didn't have a deviated septum, their gag reflex was intact, and make sure that their mental and cognitive status is there. Walk in the patient room, provide patient privacy. I would have assessed to see which size NG tube to use based on patency and what's being inserted. Then I would perform hand hygiene, put my gloves on. Hi, my name is Autumn. I'll be your nurse today. Can you tell me your name and date of birth? Great. So I'm going to be inserting an NG tube for you. It's going to either help with decompressing your stomach or by suctioning stuff out or inserting tube feed. Kind of depends on what your physician's ordering it for. So I would prepare my pieces of tape. It's very sticky. Then I will check the patency of the nares, see which one is more patent. They're both patent, so I get my option. So I'm going to measure from the tip of the nose to the ear down to the xiphoid process. And I'm going to mark my goal to see how far I want to go down. Then I'm going to lubricate it about 4 inches. And then I will put the patient in high Fowler's position. And I put this towel across his chest just to ensure that nothing gets on his gown. All right, so at the beginning, I'm going to have the patient hyperextend his neck, and then I'm gonna 1, 2, 3. And when I hit his gag reflex, I'm gonna have him tuck his chin to his chest while drinking the water. And then with each sip, I'm going to go down 2 to 4 inches while rotating 180 degrees. But for the purpose of this video and this mannequin, it only goes down if he's like hyperextended. So I'm gonna go down. Until I reach my goal. And then once I reach my goal, I'm going to put tape on his cheek to kind of secure it in place. I'm going to then aspirate the stomach contents. And then I'm gonna test it on the pH. And I'm going to instill back whatever I got out. Another way to do this would be to x-ray, which is the golden standard, but per policy protocol, that's what I would do. Third way to check it is by listening to a swishing sound. And by instilling 30 mils of just air. So I heard a swishing sound, which means that it's in the stomach. So now I am able to properly secure the NG by doing the pant method. Keeping this here. And then putting a safety pin through the gown so that it doesn't get tugged on and ripped off or ripped out. would still be sticking. So then I would document which size NG tube I used. I would how he tolerated it and all the other relevant data. And then, if he was supposed to be on suction, I would hook him up to suction, or if he was supposed to be on tube feeds, I would start a tube feed, depending on what the physician ordered. So now I would change my gloves, I would perform hand hygiene, there's a glove inside that glove. And then, that's not bad. Okay. And then, don new gloves. Can you tell me your name and date of birth? Okay. I'm going to be administering medication now, so I would have checked prior to make sure that they were able to be crushed. So I would put the medication in this little pouch, and then go in here and just crush, crush, crush until they were very fine. Then I would put about 20 mils of sterile water in with the medication to kind of help dissolve it. So I would have checked, make sure they were crushed, check with the physician, make sure that it was the right medication, that it was able to be crushed. I would do my 2 other medication identifiers outside of the room. And sir, I'm going to be administering medication now. I have 2 of them for you. So I would flush the tube initially with about 30 mils of water, sterile water. And before this, I would check placement. I would make sure to do the aspirating, the stomach contents, the whooshing sound, or x-ray, whatever was available. So it's patent. So now I'll get my 20 mils of medication. And then make sure to flush with about 20 to 30 mils. And then my last medication. Trying to minimize the air that's in there so that they don't get a lot of gas in their belly. And then I would flush once more with about 20 to 30 mils. So then I would make sure that they would stay in their high Fowler position for about 30 minutes. And if they were on suction, I'd make sure that the suction was turned off for about 30 minutes and the tube feed was also kind of slowed down or off. So now I would document that they received the medication, that they were crushed, that the tube was patent, and all the other relevant information. So now, taking out the NG tube, I would listen to bowel sounds, make sure that there was no nausea or vomiting, make sure that they were able to tolerate having the NG tube clipped and no tube feeds. So I would make sure to have tissues ready, and I would change my gloves and get new hand hygiene. But for now, I'm just gonna keep the same ones on. So I will kind of undo all the tape so that it minimizes ripping at his skin. All right, take a deep breath on the count of 3. 1, 2, 3. All right, then I would throw this in the trash, give him a tissue to kind of wipe his nose from anything that would come up with the NG tube. And then I would document how I tolerated it, if there was anything that came out in the suction, and all other relevant data.